Great. Thank you for that introduction, Mira. So you were just reminded that we are recording this session. And another quick reminder that we have for you is if you have any trouble technology-wise, please reach out to Audrey Everett as part of the facilitation team for that. And finally, we want to remind you that we do have interpretation in Bahasa, and so you can click on the interpretation button in order to get that language coming through. Okay. All right. And as a reminder, as Mira said, please put your questions and your comments in the chat box. We welcome them. Okay. And so we're going to start off with a recap of the full nutrition week and what we gained from that. But before we get started, I would like to put a poll up asking which session or sessions did you attend in Nutrition Financing Week? And so for this poll, you can select all that apply. We know some of you have gone to all of them and maybe some more have only gone to a few. So just let us know by answering the poll. Great. Okay, we have about 20% response rate so far. Let's see if we can get a few more responses. Great. All right. Okay, let's see what we have. Okay, so we've had a lot of you went to the session that was right before ours, and then we also saw many of you were at session webinar 2 as well. Well, definitely don't fret. We will hear some of the highlights from those sessions if you weren't able to make it, and so I invite our colleague Ali Somandoro, Senior Nutrition Specialist at the Global Financing Facility, to take us through that recap.
Thank you. Thanks very much. I'm trying to summarize all these exciting 5 sessions we have so far. So I'll start with the first one on the leading by example, a conversation to achieve N4G financing goal. So from that session, we learned about the importance of continuing the momentum with N4G and commit to concrete actions to strengthen financing and accountability to drive results. Some of the key points that we discuss here about these 3 important themes that we discussed throughout the week, which is on the prioritization of nutrition investment, optimizing financing and fiscal levers, and then also the accountability and data-driven financing. We also learned from the country speakers, especially from, for example, from the Vice President Office in Indonesia, about the importance of having commitment from the highest level to secure adequate domestic financing, even in the times of the crisis of the pandemic. So that's from the first one, and I will proceed to the second one on the optimizing of health financing levers for nutrition, commitment to action. In this session, we learned that the UHC-oriented health financing reforms can be used to optimize health financing levers of that consists of the revenue raising, pooling, and purchasing to strategically achieve effective coverage of nutrition service, as well as other preventive and promotive service. So some of the key takeaways that we learned there is that the key drivers for optimizing health financing levers for high nutrition service coverage are the evidence-based prioritization, to have a costed and well-defined nutrition benefits package, and to ensure that there is a better that the nutrition service are well integrated with the health sector, particularly through the primary healthcare, as well as the strategic to make sure that the country invests in health system enablers, and also strengthen the accountability measures to allocate resource to ensure that the resources are being allocated efficiently. Also, we learned about the setting up the integrated information system that allows for tracking and seamless exchange of financing and programmatic data, along with promoting culture of using evidence for planning, can go a long way to ensure in optimizing resources. So I'll go to the third one, which is the potential of fiscal policies for nutrition, how taxes and other tools can encourage healthy diets. So in that session, we learned that curbing consumption is just not about single interventions. So how fiscal policies for nutrition are introduced, framed, and communicated to the public, and how they interact with non-fiscal interventions to curb consumption does matter. So some of the key takeaways that we learned is that it's important to understand that policies which increase prices of unhealthy option and those which lower out-of-pocket prices of healthy options work together to have the synergistic impact on consumption and consumption behavior. We also learned that the approaches to simplify the structure of taxes across SSBs and foods high in sugar, fat, and salt are needed, and there are several options to options to achieve this. It's also key to make sure that these taxes are salient, so they are understood by consumer and are combined with essential complementary measures like cost promotion bans. With that, I'll proceed to the fourth one, which is on the allocative efficiency analysis for more nutrition for money, country experience with Optima. So from that session, we learned that a successful implementation of the tool to maximize the benefit of nutrition investment and incorporation of the recommendation into policies and programs require the engagement of a champion at the country or subnational level throughout the process. Some of the key takeaways that we learned that it is important to ensure high quality input data for results to be believable and also relevant and used for decision making. We also, the other key takeaways is that mainstreaming nutrition into broader UHC will have important implication for the continuity in making sure that recommendation into nutrition policy and programming are being taken. I'll go now with the last session, which we had this morning on the nutrition responsive public financial management, strengthening financing and accountability for results. So from that, through the various presentation from, I think we have 6 countries, we learned that the importance of integrating nutrition priorities in country planning and budgeting process and then to ensure that the countries the country to implement the enabling policies and reforms to ensure sustainable financing and accountability for results. Some of the key takeaways we learned there is the importance of quality of data, so then we can understand how much resources are actually going to nutrition. As a very important first step. And then we also learn about how different countries at different stages from Rwanda, Pakistan, Indonesia, and also Bhutan and Nepal, and also how country experience and using tools and process to improve program performance, allocation, and utilization of intervention to accelerate nutrition improvement. One of the lessons learned that we learned from some of the presentation is the importance of, for example, to engage and have a strong engagement from Ministry of Finance and Ministry of Planning. And then I think last but not least is to make sure that we need to focus on the use of the results, either from NPR or from budget tagging system, to inform policies and improve resource allocation, which all going to be leaded to the nutrition to a better results. With that, I think I'm going to close this recap, Cherise, and I'll give it back to you. Thank you.
Okay, wonderful. Thank you very much, Ali, for reminding us of how full a week we've had with Nutrition Financing Week. Okay, we'll now transition to the call to action, post N4G actual recommendations on nutrition financing, and we'll hand that over to Kyoko, okay, Akamura, with the World Bank.
Okay, thank you, Cherise. Thank you, Ali, for really good recap, really rich in contents. This reminded us that there is so much we can learn and further explore and take actions. So this is really the start of our journey. With that, we would now like to call to action from all of you by reflecting on the commitments that were made at the Tokyo Nutrition for Growth Summit and the themes discussed during this Nutrition Financing Week. We have a few participants who are willing to share their forward-looking action points with us. Also, after those speakers, we will pull up an interactive tool for all of you to share your actions. So please be prepared with your action points. So the question I would like to pose to all of you is to translate N4G commitments to actions and achieve the results we committed to achieving. What can you imagine doing as concrete actions going forward? Now, I would like to first call Dr. Lawrence Grammer-Strong, Unit Head, Department of Nutrition and Food Safety, WHO. Larry, the floor is yours, and you have 3 minutes.
Great. Thank you, Kyoko. Good morning, good afternoon, good evening, everyone. This has truly been a wonderful week that highlighted not just the need to ensure that financing is provided for nutrition services, but more importantly, how we can effectively accomplish that. There are a few themes that really stood out to me throughout the week. First is the need to establish clear priorities for which nutrition services would need to be paid for. To be realistic, we can't just say we're going to finance nutrition in general. We have to be specific about what services. WHO has published a compendium of essential nutrition actions that we've determined to be evidence-based and cost-effective. Some of those are for the entire population or preventive. Others are targeted services that are only needed in special circumstances. We at WHO have also published the UHC compendium, the One Health tool that describes interventions beyond nutrition, but really tries to package them in a way that we can really understand what the differences are, what those services are, and help decision makers to really define core packages for healthcare coverage, including nutrition. Second, we need to develop appropriate financial incentives to ensure that those nutrition services that we prioritize as being important actually get delivered on the ground. For too long, we've paid lip service to the importance of nutrition, but then when it actually comes down to what happens in clinics, resources end up being focused on acute services, disease management, specialized issues that need to be handled on a day-to-day basis, but we end up forgetting about the nutrition priorities. So we really need to use these key financial levers that were discussed this week, things like output-based financing, performance-based financing, and explore how they can be applied along with other purchasing methods to make sure we're incentivizing health workers so that they actually deliver the nutrition services that we think are important, particularly preventive services that are too often forgotten. And then finally, we need to do better in our data to understand what we're actually spending on nutrition services and tracking it over time. The budget expenditures nutrition need to be tagged, analyzed regularly so that we have the information on whether we're actually making the changes that we intend to on nutrition financing and whether they're actually turning into coverage on the ground. Are they actually working? We need better data on coverage of nutrition services that's timely and that can be examined at local levels so we can evaluate and plan our programs with their financing. The Nutrition for Growth Summit galvanized countries and donors to make bold commitments on addressing malnutrition. Now it's time to make sure that those financial levers are not just putting more money into nutrition, but are ensuring that the money we do put into it is actually effective and is truly improving services on the ground. Thank you.
Thank you very much, Larry. This is almost like a summary of what we have really discussed this week. Thank you so much. Now I'm pleased to invite Dr. Ada Al-Knaibet, Chief Officer, Public Health Intelligence, Public Health Authority of Saudi Arabia. We welcome your 30 minutes intervention. Thank you.
Thank you. Thank you for that. And thank you for the invite. This is a very exciting topic and I think very relevant to the issues we face when it comes to NCDs and the outcomes and the global burden of disease related to these nutritional issues. In 3 minutes, I'll just summarize what has been done in Saudi Arabia in the past few years when it comes to food and trying to improve nutrition in the country. Most of these efforts started in 2017, and I'll just divide them into 3 main areas: taxation, reformulation, labeling, and then some public health regulations that have been implemented. In 2017, the VAT for the carbonated drinks was implemented. It was a 50% VAT. And in 2017, also a 100% on energy drinks. 2 years after that, sugary beverages, there was a 50% VAT on beverages that had artificially sweetened. And then, and so that's for the taxation on when related to sugary beverages as well as energy drinks. There's a few of the regulations when it comes to reformulation. Those pertain, one, to salt in bread, and that was implemented in 2019. In also in 2019, it was implemented that restaurants should have the calories per item sold on the menus, as well as mandating the calories in the nutritional labels on in grocery stores. In 2020, there is a ban on PHOs throughout the country. And then finally in 2021, there was the mandate of displaying the amount of sugar added on items. Finally, I'll just touch on two other regulations that relate to sugar drinks. There are some regulations when it comes to schools and some governmental entities where they specify the type of food items that are allowed in these areas or these entities. And then I'd finalize and reiterate some of what Larry said. From our concern, there's also how what has been done, whether it's the most efficient and most impactful regulations that were selected. We are trying to monitor and evaluate their effect. We need to highlight that in Saudi, some of these taxation were implemented shortly with or actually lateral to the sales tax. So it was a bit difficult for us to parse out what was actually a change in behavior due to taxation because of the on the food type, or was it the sales tax? I would like to also emphasize we are looking into modification of the way taxation is done. As I mentioned, these are all or none, so there's no tier taxation. That may be an area to explore that would also promote and stimulate other manufacturing to change reformulation when we do it tier taxation. So these are two different areas that we need to look into on it. And I would say also expanding the way we tax. Currently, the focus is on beverages. Food, there's not yet taxation on food items that are sugary or have certain unhealthy components. I think that covers my 3 minutes, and thank you very much.
Thank you very much, Dr. Ada. This is really wonderful to hear that Saudi Arabia is continuously moving this agenda, revising, reviewing, taking next steps. Thank you so much. Now, we would like to have Professor Mark Hansen, Chair of PMNCH Knowledge and Evidence Working Group. Welcome, Professor Hansen. You have 3 minutes.
Thank you very much, Kyoko, ladies and gentlemen. So I'm speaking to you today on behalf of PMNCH, the Partnership for Maternal, Newborn and Child Health, which is the largest alliance for women's, children's and adolescents' health and well-being, with over 1,000 partner organizations across 10 constituencies, and it's hosted by WHO. You may also know me as the University of Southampton's lead on early life nutrition and one of the architects of the developmental origins of health and disease concept. For many decades, there's been broad agreement about the need for, quotes, good nutrition, quotes, especially in early life. But the reality is that globally today, nearly 150 million children under 5 are still stunted and over 45 million are wasted. And at the other extreme, almost 30 million children are overweight. So the effects of such malnutrition will change their health and the risks of chronic disease for the rest of their lives. The negative effects of today's poor nutrition for fetuses, for infants and children will play out across generations, and it'll affect economies, societal resilience to a range of challenges, well-being, and worsening inequalities. Moreover, despite progress in some areas, globally, the nutrition of mothers, children, and adolescents is actually being made worse by climate change, by conflict, those who live in fragile settings, and of course, the COVID-19 pandemic. Above all, policies, investments, and social protection measures for good nutrition need to put marginalized and vulnerable groups such as adolescents, those forcibly displaced, indigenous communities, and persons living with disabilities at the centre, both as beneficiaries, but also as collaborators in driving policy. With our global reach, PMNCH is uniquely positioned to address the promotion of early life nutrition. We need, of course, knowledge and evidence to create advocacy in order to change policy. And this is fundamental to PMNCH's mission. So, for example, we create resources enabling policymakers and advocates to access the evidence they'll need to effect change. We work with professional bodies such as FIGO, the International Federation of Gynecologists and Obstetricians, which is developing a simple nutrition checklist for women in early pregnancy and their healthcare providers. And we work with educators to develop materials to promote nutrition literacy in young people. We know that financial concerns often drive policy formation. So one of our key aims is to promote equity-enhancing financing mechanisms for nutrition and health. Going forward, we hope and intend to form strong strategic partnerships with GFF, the World Bank, Gavi, and of course WHO at national and international levels, so that specific expertise offered by PMNCH can have the maximum global impact on the crises in nutrition in early life and across generations. Achieving the step change in early nutrition needed will require making the case for investment and highlighting the costs of inaction and lack of investment in MNCAH. PMNCH is actively engaged in this work, scoping previous and ongoing investment cases, finding the gaps in our knowledge, and updating our economic models. So the vision of PMNCH is of a world in which every woman, child, and adolescent is able to realize their right to health and well-being, free of poverty and leaving nobody behind. And we look forward to working with you. Thank you for listening.
Thank you. Thank you very much, Professor Hansen. This is really encouraging to have such concrete action point support from such a big coalition of groups. Thank you so very much. Now, again, I would like everyone to start, thinking about the commitments you have heard and any action points that you would like to put forward at the end of this, the speakers. Now, I'm very happy to invite Dr. Mustafiz Rahman, Line Director, National Nutrition Services, Institute of Public Health Nutrition, Directorate General of Health Services, Ministry of Health and Family Welfare of Bangladesh. We welcome your 3 minutes intervention.
Thank you. Good morning and good afternoon. It's my pleasure to be part of one of the panel members of this important event and discussion. Thanks to the organizer for giving me this opportunity. During this Nutrition for Growth Summit in December 2021, our Honorable Prime Minister Sheikh Hasina pledged to address the double burden of the malnutrition through 12 distinct commitments. The first of this commitment is to strengthen multi-sectoral tracking of the financial allocation for the nutrition. This commitment originated from the long process of increasing public finance for nutrition, with the latest step being the public expenditure review. At National Plan of Action for Nutrition to initiate the resource flow for nutrition through 22 ministries, it was necessary to undertake effort to further understand nutrition intervention across those ministries for both nutrition specific and nutrition sensitive intervention. For this reason, in 2019, as a commitment of the Bangladesh to the Sun movement, a public expenditure review for nutrition was conducted. For the analysis of the level and the composition of the public expenditure on nutrition, access was provided to all relevant internal government financial system through IBUS+++. This was the first time costing analysis for the nutrition sensitive intervention was included in costing assessment on nutrition in Bangladesh. The PERN analyzed the level and the composition of the public expenditure on nutrition across all the relevant ministries, assessed the efficiency and the equity of the nutrition spending, assessed the institutional mechanism for the management of the public financial for nutrition, provided a baseline to monitor the progress towards the budget allocation and the execution goal of for nutrition. The PRN found that in 2016-17 fiscal year, US dollar 2.7 billion was spent on nutrition relevant intervention, which was 1% of the GDP and 9% of the total government expenditure. It was also found that the four ministries were accounting for 80% of the total nutrition relevant expenditure. This ministry were Ministry of the Food, Ministry of the Health and Family Welfare, Ministry of the Primary and Mass Education, and the Ministry of the Women and Child Affairs. And finally, quite significantly, only 2% of the total budget for nutrition was spent on nutrition specific intervention, while 98% of the budget was spent on the nutrition sensitive intervention. From 2019, Bangladesh National Nutrition Council started to engage the activity and they coordinated with all 22 ministries to work with their nutrition focal person to develop costed nutrition focused work plan. The first costed work plan were subsequently developed from the 2020, which was possible because PERN enhanced understanding on the PFM for nutrition among the ministries and a result of strong advocacy by the Bangladesh National Council, National Nutrition Council, UNICEF, and other partners. And most significantly, the development of a financial tracking mechanism for nutrition intervention was approved by the Ministry of the Health and Family Welfare through intensive advocacy from the BNHC, UNICEF, and partners. This financial tracking mechanism will enhance the transparency of nutrition investment and increase accountability of and support advocacy for increasing fiscal space of nutrition. The multi-sector financial tracking will follow two steps as suggested by the SUN guideline. Step 1, identification and the mapping. Identification the relevant budget line items, for example, program or the department, based on the list used by the PERN and through a search to key terms. Step 2, categorization. Assess whether the programs or the departments found fall under the category of nutrition specific or the nutrition sensitive intervention. System will use secondary data from existing sources, for example, integrated budgetary accounting system, that is IBUS++, National Health Account and Information Management System, AIMS, budget and the expenditure reports from government ministries. Food planning and the monitoring unit, FPMU, 4 levels of the analysis will be undertaken: nutrition related allocation, temporal trend, geographical variation, gender and equity. Thanks everybody for your patience hearing. Thank you.
Thank you so very much, Dr. Mustafiz. This is really, really great commitment and very concrete actions put forward. Now, I would like to turn to Simon Bishop, CEO of the Power of Nutrition. Simon, the floor is yours, and you have 3 minutes.
Thank you, Kyoko. At the Power of Nutrition, we're taking 3 concrete actions, all designed to bring more finance into nutrition. The first one is to move from an historic focus on stunting to cover all of malnutrition, including overweight and obesity, and to move from predominantly health systems interventions to take a multi-sectoral approach. The second one is to launch 2 new initiatives. The first one is called Nutrition Flex, and this builds on our fantastic track record to date since we were born out of the 2013 Nutrition for Growth Summit. For example, our Madagascar program, the Madagascan government was planning to take out a $40 million World Bank IDA loan for nutrition. We came along with some grant money and said we would put that in, but only if they expanded the program. So it ended up being an $80 million IDA loan, and we use some of our grant money to ensure that the quality of the programming, so we got more nutrition for the money, was better across the 80 million. I'm delighted to say we'll carry on that wonderful partnership with the World Bank and with country governments in the years ahead. And we've just signed up a new partnership with the Islamic Development Bank and the World Food Programme to do a similar model in countries that the ISDB serves. And they'll have similar incentivization mechanisms in it. Our second new initiative is called Nutrition Ventures. With DRA in decline and traditional grant in decline, we think we need to go where the money is. And one area where there is growth in money is innovative financing. So Nutrition Ventures will be a new platform that pilots, develops, and scales innovative financing mechanisms for nutrition. The third thing we're going to do is to be even more of a tenacious sector champion and public good for the global nutrition sector. For example, in a few weeks' time, we will publish new research that shows the cost to businesses in lower and middle income countries of stunting. And we hope this will incentivize businesses to make tackling stunting a greater priority. This will be open source research, open source data. So for example, if you're an actor in Ethiopia, you'll be able to cut the data by the impact, the cost to Ethiopian businesses, and by different sectors like the garment sector or the food sector. So a genuine public good that actors across the world can use to make the case to businesses that they need to step up and do more for nutrition. All three of these things, we hope and believe, will increase financing into nutrition. Collaborate, collaborate, collaborate is our mantra. We want to do this in partnership with others. So if you do want to partner, if you're excited by anything that you've heard me talk about today, then please get in touch. Thank you very much.
Thank you very much, Simon. Collaborate, collaborate, collaborate. Thank you so much for really working on the private sector side and connecting this to the actions on the ground. Now we have the final speaker, Asma Latif, Policy and Advocacy Lead from the SDG2 Advocacy Hub. Asma, the floor is yours and you have 3 minutes.
Thank you very much for having me. And what an amazing week. It's been incredibly interesting and exciting to hear about the innovative approaches at the country level and the fiscal policies that can both generate new resources for nutrition, but also have a nutrition impact. A lot has been said, so I thought I would use my time to situate this important conversation within the broader shifts that we're seeing and the opportunities for nutrition, as well as on the advocacy and accountability role of civil society. As I look back on last year, I think it was actually quite fortuitous, perhaps a silver lining of this global trauma that we've all been living through, that the Nutrition for Growth Summit was delayed by a year. Because COVID-19 really has made so clear the vulnerabilities we face as a global community. Malnutrition and nutrition-related health issues have exposed too many of the worst impacts of the disease, and the lockdowns and other responses to COVID have made it much more difficult for vulnerable communities to access nutrition and health services. By all measures, we have lost too much ground over the last 2 years. Against this backdrop, last year's summits, the Food Systems Summit, the Climate COP, began crucial conversations and led to policy commitments around healthy and sustainable diets, paving the way, I think, for further discussions and commitments at this year's G7 summit in Germany and at the future COPs, COP27 and COP28. Combined with the historic IDA 20 replenishment, I think this presents some important opportunities for nutrition. As we think about nutrition finance, it is important to begin to position nutrition as integral to these broader agendas. Over the next few years, we will see a ramping up of finance for climate adaptation, for resilience, and for food systems transformation. We need to think strategically about tapping into those resources, potentially vast, to deliver on nutrition outcomes. Good nutrition is critical to resilience, to bouncing back from shocks, to agricultural productivity, to mitigating and adapting to climate change, and to reducing overweight, obesity, and related NCDs. In essence, good nutrition is key to prevention of many of these complex challenges. And prevention of malnutrition is, as so many have said this week, key to equity and to inclusive economic growth. Yet it is still not seen as a foundational investment. The nutrition community needs to engage now in the follow-up to the UNFSS and the lead up to COP27 and 28 to ensure that nutrition is not an afterthought or forgotten altogether. The second point I'd like to make is really about the critical role of civil society. Civil society organizations can be influential partners in advocating for nutrition, for new resources to integrate nutrition across sectors in health systems, social protection, school feeding, agriculture, climate adaptation, and emergency and humanitarian assistance. Many are well placed to translate data, research, and technical information for decision makers. They're implementing programs at the subnational level in communities, and they have the know-how and often the trust of the communities to know what the needs are and what works and what doesn't work. Civil society is also key to accountability, advocating for tagging and tracking nutrition indicators in budgets and meal approaches, again, across sectors and at the subnational level. We got an example of this.
Asma, you have 30 seconds left.
Okay, I'm wrapping up. We got an example of this in Hugh's interventions in the chat in the last session. The Sun Civil Society Network works with civil society alliances across Sun countries. In many countries, these alliances are working with parliamentarians to help them understand why it's important to invest in nutrition, what is being spent, what is needed, and how it's being targeted. Engagement of parliamentarians will also help ensure that there is broad buy-in to spending on nutrition and that prioritizing nutrition is not disrupted by changes in government. With only 8 years left to achieve the Sustainable Development Goals, it's urgent that we take an all hands on deck approach and go beyond our comfort level to engage different sectors and different stakeholders. I'll stop there. Thanks.
Thank you. Thank you so very much. Exciting to hear a lot of forward-looking, inspiring actions from a variety of partners. Thank you very much. Now we would like to quickly move on to a Padlet where you can put your action points. Please, we really have only 5 minutes left. We might
Kyoko,
extend.
and
Yes.
forgive me, before we do the Padlet, there was an ask to relaunch the poll so we can get a sense, and we've had a number of colleagues join since the original poll. So we apologize for the technological glitch earlier, and let me invite you to give us a sense for all our participants. If you joined earlier in the week, you can actually now do a multiple choice for how many of the sessions this week you've actually attended. Thank you. We see, please feel free. We've got 35%, 37%. We'd love for all of you to share with us. How many sessions this week did you actually take part in? We've got 45% of you have voted. I'd love to see a more robust response rate, please. This makes me very happy. There's nothing like a happy facilitator. We're at 54%. Please, please keep it coming. We're at 58%. Now we've gone well past the halfway mark. We're at 62%. It helps us better understand where the focus of your emphasis actually was. And what I'm going to do, we are at 65% for those of you who voted. 67%. Excellent. Let's close that out. And this gives you a flavor for the number of sessions that participants currently attended. We're going to go ahead and save that poll. That's helpful information. And thank you, Kyoko. You teed up where we want to go next. Let me share with you how we're going to welcome your input through using what we're calling a Padlet. I will offer the instructions and then happily hand the floor back to Kyoko to share how we're going to look at this. So we want you to imagine, given what you've heard, now it's your call to action. What can you imagine doing? We'd like you to either click on the link Audrey has just put it in the chat box, or you're welcome to use your phone and take a photo of that QR code, which would automatically take you to the Padlet app on your device. Now, you can see demonstrated, this is what it looks like. Audrey's showing you how you can share your commitment. You see the red circle in the bottom of the corner. You click on that, and now you're going to type in a subject, example, and then down below you can write in text. So maybe you put your name at the top, or you put your organization at the top, and now we've got your commitment. So I'm going to ask you to just take a minute, if you could, make your way to the Padlet, and we'd love to have you start adding, what do you imagine you could do? And Kyoko, thank you for allowing me to interject, and I'm so delighted to hand the floor back to you as our colleagues move to the Padlet and share what they can imagine doing.
Okay, thank you, Laura. So please do put your actions into this Padlet. We will start seeing your posts. Implementation of nutrient profiling. That's great. It's a really good trigger point. Nutrition, UNDP, WHO to continue to work on developing investment cases for nutrition. Yes, conduct a nutrition PR to better capture resources. Yes, this is exactly what we have also discussed. Any other posting? Please, any action points? Okay, conducting assessment research. That keeps changing. Facilitate nutrition planning and tracking. Tagging and tracking nutrition spending in your organization. Wonderful. Yes, analyzing the domestic budget in Malawi and Ethiopia. Wonderful. And maybe Indonesia. Yeah, I think a lot of the action points actually really, directly, they move the needle on the nutrition financing towards something more effective and sustainable. Thank you so very much. Keep posting. I think we'll gather this and keep this as information that we received from all of you. Thank you so much. This is very inspiring and encouraging. And we have next, what's next? The summary and also a closing remark from the government of Japan. So please stay online. Thank you.
Great. Thank you very much, Kyoko, and everybody else. I hope we can have you stay with us for an extra 5 minutes. I know we're almost out of time. But we do want to close with some thoughts and continue the Padlet, continue inputting your feedback in the chat line as well. So I just want to, in terms of what's next, I do want to say we've been inspired by what's been discussed over the last week. We were inspired by the level of engagement we've had in all of the sessions. We were a little bit worried that it might be overkill, but given the engagement, it's very clear it's not overkill. I think what we have really focused on is not so much why we are investing in nutrition, because that really was a big discussion before N4G. But really now we focus much more on the financing side and how to invest in nutrition so that we get the maximum bang for the buck. That really has been the focus. And I must say, I want to put in a plug over here that while health financing is a regular field of study people get trained in, nutrition financing, there is no academic institution that does training in nutrition financing. So if any of the academia groups are here today, please take that message back. We really need to develop this field. And what you heard this week was just the beginnings of the sorts of things that can happen. So as we go forward, we're hoping that you will share what you learned. during the week, share it within your countries, within your constituencies, share the tools that were discussed. And if you need inputs on those tools, our teams are ready to help support with technical assistance and anything else that you can that you need. We want you to go ahead and advocate for why nutrition is important, but much more on how to finance nutrition and how to deliver these services in a way that you get the maximum bang for the buck. That really has been the focus of this conversation. You also heard from several of the speakers that we need to build a coalition of stakeholders from across so many sectors, and that is absolutely critical as well. So I hope each of you in your countries will continue to build that coalition, because without that, it's not going to happen. And of course, I do want to say we want to share, we want to keep hearing back from you as well. So let's keep that line open as well so that we can do more in this space. In our internal feedback, I suggested to the team that we have a nutrition financing week every year, and there were gasps from the team saying, oh no. But it would be good to hear from all of you. If you find it useful, please tell us, and we're happy to try and continue something like this. I don't know, every year or whatever, but it's very clear that the legacy from Nutrition for Growth needs to continue. It wasn't a one-time event. It really is a longer-term effort. So with that, Laura, Charisse, are we going to do a feedback? Or should we move on to the next?
Yes, well, Mira, we're going to put a link in the chat box where everyone can put additional topics that they would like to explore related to Nutrition Financing Week throughout the year. So again, if you just click on this new link, you'll go there and you can put as many ideas as you would like to. And then we will transition to our closing speaker. Mr. Takahiro Tsuda, Alternate Executive Director for Japan, World Bank Group. Mr. Tsuda, you're welcome.
Thank you very much, Charisse, and thank you all. Just as a final remark, I know that this week is a great experiment, indeed, and having 5 or 6 seminars in a week, and it turned out to be a great success. I learned more than 100 participants joining each seminar. With the help of social network and any other in-person network, our voice, in other words, calls for actions, should be heard by the larger audience. I'd like to thank everybody who made this event happen, especially the World Bank and the GFF team. I know that the time is running out, but I'd like just to share a small story why my country, Japan, cares nutrition much. Japan launched its annual nationwide health and nutrition survey just 3 years after the end of World War II in 1948. 3 years after the end of the war means that we were still totally devastated. But ever since, we have duly continued this effort without fail. My country's founding leaders were keenly aware of the critical importance of human capital, in particular health and nutrition, at the very early stage of development. And they are right. Sufficient level of nutrition boosts the labor supply in economic sense, but beyond that, support education, improve public health, and strengthen social cohesion, serving the very foundation of our country's post-World War II economic development. I'm not saying that other countries should blindly follow suit, but because every country has its own agenda, obviously we needed to tailor approaches to country-specific development needs and sometimes improvise given the unprecedented crisis in front of us. Hence, in this regard, the series of seminars this week provided us with a great opportunity to equip ourselves with necessary knowledge for this purpose, such as financing tools, public financial management, data analysis, communication and advocacy, and so on and so forth, by learning from each other. I know that we are not reached the SDG goal of ending with malnutrition yet. At the same time, given the great success of this week, I strongly believe that we are making a huge step forward toward this common goal. So thank you very much, and congratulations once again, and back to you. Thank you very much.
Thank you very much, Tako-san, for those inspiring words. And also a big thank you to the government of Japan, not just for holding N4G, but also the IDA 20 replenishment. And for hopefully you will stay partners with us going forward in implementing the commitments that were made at N4G. So with that, I want to take 1 minute to thank everybody else who has been part of this this week. First, a big thank you to all the attendees. Thank you for staying. It's amazing how many people have stayed with us through the entire week, and some of you have attended all the sessions. Thank you for your commitment to the agenda. I want to say a big thank you to all the panelists. You really added to the depth and breadth of this emerging nutrition financing agenda. And we will call on you over and over again because you did such a fabulous job. And I especially want to thank the panelists from the countries, Pakistan, Tajikistan, Indonesia, Rwanda, Sri Lanka, Nepal, Saudi Arabia, Bangladesh. I mean, all of you really brought some of the theoretical things that we talk about, you brought them to life with the lessons that we learned and the strong focus on how you did it, what your challenges were, and I'm sure we all learned from each other. I want to thank the partners who have been with us in organizing this Nutrition Financing Week, WHO, the Bill and Melinda Gates Foundation, Results for Development, the Joint Learning Network, and certainly TRG, the facilitating group as well. All of you have been amazing. So thank you all. And of course, the government of Japan. Before we close, I also want to say a big thank you to our own team, the World Bank and the GFF team that organized this event. And I won't name all of you because there have been so many people from the global level as well as the country level who have contributed, but I will take the liberty of naming 2 individuals who have really masterminded this event, and that is Kyoko Shibata and Ali Vinotto. Thank you too. This would not have been possible without the many nights you spent without sleep and the effort that you put into this. Your dedication is just amazing. So with that, thank you again, everybody. And we will wait to hear from you about next events in this space.
Great. Thank you all. We look forward to seeing you
Thank
another
you.
time.
Thanks, everyone.
Goodbye, everybody. Take care.
Bye.
Bye.
Thank you.
Thank you. Bye-bye.
Thank you.
Thank you.
Bye.